Dr. Sammy Gibson with Eastwood Animal Clinic. One of the things we're going to talk about today is heartworm disease. Summer's around the corner, it's not too far, and we start getting more wet weather, therefore we get more bugs, therefore more mosquitoes, therefore more transmission of disease. Side note, some of you I'm sure know, some of you don't. Mosquitoes are probably one of the #1 killers in the world for people and just kind of everything. They transmit so much disease. One example that most people would be familiar with would be malaria. Back when they were building the Panama Canal, malaria killed hundreds and hundreds and thousands of people. And malaria is not as much of a problem as it used to be, but I'm just giving an example. Mosquitoes transmit a lot of disease. Back to here in El Paso, we live in a desert. The desert, there's not very much water. So we do have heartworm disease here in El Paso. Just because it's a desert doesn't mean we don't have heartworms. We have mosquitoes, and it's just not as prevalent as it is in other areas of the country where it's greener. Most areas are more green than El Paso. Heartworms are spread through mosquitoes. It's a little microflaria, aka a microscopic little parasite that gets in the mosquito, and the mosquito bites an infected patient, dog, cat, a varmint, raccoon, skunk, whatever, any kind of mammal typically. And they'll bite that patient and then buzz around and feed on another patient, and that's how the disease is transmitted. Everybody knows what a mosquito looks like. They have their little vector and they poke it in the skin and they inject basically the heartworm microflaria. Just because a patient gets introduced to the microflaria and the heartworm, let me back up. Just because a patient gets bit doesn't mean they instantly have heartworm disease. The bug takes about 6 months to grow to maturity, and it'll just migrate itself through the body and get into the heart, and that's why it's called heartworm disease. Heartworms are transmitted through mosquitoes. Once they get in the heart, they start to grow and they affect the valves, and they can cause a bunch of other problems. They can throw clots that can go in any place in the body, and once the damage is done, it is done for life. Over the last few years, we've come a long way, and we can actually treat this now. We can't reverse the damage that has been done, but we can treat and kill the heartworm disease. There's a few different protocols out there. Every veterinarian will do a little bit tweak on one variation, but there's a couple different ways to do it. They all seem to be effective, so as long as you get the job done. The best thing to do is preventative medicine. It's easier, it's way cheaper. Most patients, it's between about $1,000, $1,500 to treat for heartworm disease here in El Paso. Other areas of the country, it's usually way more expensive. Heartworm prevention, depending on the size of your patient, it'll range anywhere from about $5 to $10 a month. And basically what it is it's a little chewable that you give. Most patients really like it. We very rarely see side effects with it. But just like anything, there's always a potential, and certain breeds like collies are a little bit more predisposed. A couple years ago, they came out with an injectable form called ProHeart, and it's basically a 6-month injection for heartworm disease. One trick with that is you do have to be negative before we give the shot. It is so potent that if we give the shot without testing and you have the worms, it will kill the worms. The problem is then you have this full adult worm that we just killed, and now it's going to float in your vasculature. AKA what that really means is you're going to have more clots, you're going to have more chances for embolisms and things of that nature. So you got to be careful of that, and that's why we have a certain protocol that we follow. Back to the Heart Guard, which is usually the prevention medication that we give once a month, ideally for life. It's just good general wellness medicine for these guys. And you want to start them on it as soon as you can. Once these puppies get weaned off and they can eat hard food, you can start them on heartworm prevention. You can't run the heartworm test. Due to the life cycle of the way the parasite works, it takes about 6 months for the worm to mature, aka show up positive on our test. One little trick is between some of the different species, they get different parasitic burdens. aka cats usually have between 1 to 5 worms, dogs can have 20 to 100. Now the way the test works is it's kind of like a pregnancy test. It picks up certain hormones, and it picks up the hormones that are secreted by the female, not the males. So if we have a cat and you have 2 worms and they are both male, the test will say it is negative. But in real life, it's positive. We just don't have a test to find the males. We only have a test to find the female worms. In dogs, if you have 20 to 50 worms, the probability of one of them being female is much higher than 1 or 2 worms. Therefore, we find more and diagnose more in our canine patients than we do in our feline patients. One misnomer is that, cats don't get heartworm disease. That's what we used to say 10, 20 years ago. We were wrong. Cats did get heartworm disease. We just learned that we couldn't test for it, therefore we were missing a lot of them. Cats do seem to have less problems with it, less complications than we do with dogs. Is that just because we're missing it and we don't know, or because they actually have less problems? I do not know. And there's more research that still needs to be done to clarify that answer, and we just don't quite have the numbers, or at least I'm not aware. Usually what we'll do with cats, they're not like dogs. They don't usually take a treat or anything that we hide in, bread, cheese, something like that. But there's different topicals that we usually use. Probably one of the more common ones are Revolution and Frontline Pluses and things like that. We treat for fleas and ticks and heartworms as well. There's a lot of different products out there for different things like this, depending on what area of the country you are. There's different geographical recommendations for this medication and this medication for heartworms, flea, tick, individually separate. It just varies by doctor. So ultimately, just summarizing the heartworm disease for these guys, you want to start them on prevention as soon as you can, usually about 6-7 weeks. And that way when you run the test, we usually recommend the test at 7 months. The American Heartworm Association recommends it at 6 months. A lot of other manufacturers will recommend testing at 7 months so that we miss less patients. And you want to keep them on the prevention once a month, ideally for life. You want to do your heartworm test at 7 months. And if you're positive, just talk to your veterinarian. We'll walk you through the process and go from there. If you're negative, great. Keep doing a good job. Do your thing. And do the best you can to stay on your prevention. And if you have any questions, just let us know. But hope that helps you guys out a little bit. Try and get rid of your stagnant water around the house and areas if you're doing a lot of walks. Or around parks or streams, things like that. Take them hiking. Just stay on top of your general wellness with your flea and tick prevention and your heart guard. Hope that helps you guys out a little bit. Take care.